Potter. He is a healthcare industry whistleblower, former head of corporate communications for Cigna, one of the largest health insurance companies in the United States, now a senior fellow on healthcare at the Center for Media and Democracy, the website prwatch.org. Wendell Potter, thanks for being here with us.
Thank you, Thom.
It's great to have you. I wanted to just share this with you. A listener sent me an email. She is her health insurance company is apparently Anthem, and she got this email from her health insurance company, which says, as you know, or maybe she's an employee, I'm not sure. It says, as you know, our company has been pursuing responsible and sustainable health care reform as the Senate and House of Representatives have been working this summer, and we will continue to do so going forward. We have also launched our grassroots website. Now, this is a big corporation. They've launched a grassroots website, the WellPoint Health Action Network, to assist you with contacting your elected officials, as well as notifying friends, neighbors, and family members about this important issue. Regrettably, the congressional legislation as currently passed by 4 of the 5 key committees in Congress does not meet our definition of responsible and sustainable reform. Here we have a multi-billion dollar, I'm assuming, certainly a multi-$100 million corporation launching a grassroots effort?
Oh, yeah, and multi-billion is right. It's one of the 2 very largest health insurance companies in the country, and it's a very big for-profit company, as is Cigna. And
where
I work. This is something that goes on all the time whenever there is any kind of legislation that might threaten these companies' profitability. I was a part of it when I was at Cigna, and it is done to generate, to try to get employees to send letters electronically to members of Congress. It's very, very sophisticated and very easy for the employees to do. All they had to do is to go on to their work site to click on go on to the internal intranet site and just make a couple of clicks, and the letter's off to the members of Congress.
And I would guess that probably for a lot of these employees of these corporations, they're thinking, okay, if my company gets put out of business, I lose my job. And if I lose my job, I can't support my family, and that's a pretty damn scary thing. And so they're going along with this. Can you speak to that and what alternatives might happen if we had a national health care system?
Oh, absolutely. It's a certain kind of intimidation. The industry works with the employees in the industry, as I said, many times over the course of years. But if you work for an insurance company and you're worried about losing your job, you want to do something that will help your company succeed. They call it winning in the marketplace, or making sure that responsible health care reform is passed. It's responsible health care reform for the special interest, but not for the American public.
Right, and yeah, in fact, that's what the company said. It doesn't meet our definition of responsible and sustainable reform. These large health insurance corporations are creating this whole AstroTurf movement. When you were with Cigna, how is that done?
It's done through a variety of ways. The companies that have a large membership in the Medicare Advantage programs, and these are the Medicare HMOs in which the government pays a big bonus to these big insurers to cover members of the Medicare program, they will recruit, or they'll find senior citizens to do the same thing. They'll fly them into Washington to serve as citizen lobbyists, paying all their expenses to do that. They'll get them to call their members of Congress. I learned from someone just the other day that in Florida, there were the health insurers, one health insurer in particular. In fact, my former employer, Humana, several years ago, which is very big in the Medicare program, is having robocalls made to the office of Senator Ben Nelson to try to get him to vote against any cuts in the Medicare Advantage program.
Amazing. We're talking with Wendell Potter, the former head of corporate communications for Cigna. This was a vice president level job?
It was, yeah.
And talk for a minute about, I've been ranting on this program for some time about Stephen Hemsley over at United Healthcare. The previous CEO was Dollar Bill McGuire, who walked away with a $1.78 billion compensation package for 10 years. So far in the 5 years that Stephen Hemsley has been there, I believe it's been about 5 years, he's racked up about $750 million in stock options and other compensation. Between $500 and $700 million. when you were in that world and when you were operating at that executive level, do these guys live in a world apart from us? I mean, was it really the picture that we have of flying on corporate jets with a dedicated flight hostess and gold-rimmed china and limousines and that whole kind of thing?
It is that kind of an existence.
And that's what you experienced?
That's what I experienced. Not me. I didn't have a chauffeur. I'll say that. I was not one of the. I was not at that level. But the CEO and a few members of the executive management, a very, very small number of people, are paid enormous amounts of money and given unbelievable perks. Just imagine getting up in the morning and walking outside your front door and being picked up by a chauffeur driven to work in a company-owned limousine and working there for until lunchtime, and someone else, another employee, brings your lunch to you free of charge. And then at the end of the day,
fancy 5-star meal.
Yeah, and at the end of the day, when you're either going to go home or to the corporate jet to fly to a meeting, your limo will be there waiting for you at the front door, take you to the airport or to your home back again. You're working in a luxurious office, so you live in a world that is unlike anything that most Americans can even imagine.
And in fact, your epiphany, after watching Americans lining up to get health care in one of these, well, you can tell the story very quickly, but your epiphany occurred on a corporate jet, didn't it, as you were contemplating this?
It did. Just a few weeks before that, I was at a healthcare expedition in southwestern Virginia, near where I grew up, and the hundreds and hundreds of people were there to get free care that was being provided in animal stalls by doctors who were volunteering their time. And a lot of these people had insurance. Almost all of them were working people who were either uninsured because they couldn't afford premiums, or were insured but they had inadequate insurance, which is something a lot more of us are going to face in years to come. Mm-hmm. But just a few weeks after that, I was in a corporate jet flying from Philadelphia, where I worked, to another meeting, and it was then that it just hit me that people who were paying their premiums, their hard-earned money in premiums, were paying for me to fly that way. And many people don't have insurance because they're excluded from it because of overpriced premiums. And they're overpriced so that I could travel that way, and that the executives could be paid as much as they are, and that a big portion of those premiums will go to shareholders in terms of profits.
Yeah, I have taken the position, and I keep every conservative who comes on the show, I ask them the simple question. I've taken the position that for-profit corporations simply should not exist when it comes to primary health care. They're banned by law in every industrialized country in the world. If there are insurance companies, they have to be not-for-profit. And is there any reason that you can think of why these corporate CEOs should have these kind of perks? These corporations should be distributing profits out of money that is paid in by people like you and me to ostensibly give us health care?
No, there is no reason. I think a lot of people who are advocates of a free market system just don't realize exactly what the free market system here that is based on for-profit companies that control our health insurance and our health care in general, what that has done to really wreck our health care system, why it is the most expensive health care system in the world, and why so many people are excluded from it. You're right. The other countries in the world that do allow insurance companies to operate, and many do, prohibit them to make a profit. There are no for-profit companies that operate in Switzerland, for example, which is often held up as a model, or the Netherlands, or other countries.
Yeah. So a pox on all their houses. But you know, there was even a national public radio or a Corporation for Public Broadcasting, a public TV special that was made. And the guy who put the thing together pointed out in it that for-profit health care is banned all around the world. And the Corporation for Public Broadcasting made him take it out. He's now out with a book about this. It's an unspeakable truth in America, Wendell Potter. And we have a little less than a minute here to wrap this up.
It's an unspeakable truth. And I think that it is just something that the insurance industry has obscured. They don't want you to know how much money they make. It's difficult to get information about the insurance industry. And it's purposely that way. They want to make sure that they take as much of your dollar and skim as much of it as they can, so that it does not go to pay medical claims, but enriches their executives and their shareholders.
Yeah, and the profit motive and keeping people alive really, or at least paying the bills. I mean, I have no problem with physicians, making money and pharmaceutical companies and companies that make machinery and whatnot, but just the bill the guys handling the bills in the middle makes no sense. Wendell Potter has been with us. He was the former vice president and head of corporate communications for Cigna. He is now a senior fellow on healthcare at the Center for Media and Democracy. PRWatch.org is the website. Wendell, thanks so much for dropping by.
Thank you, Tom.
It's great having you here on the show.